Welcome, everyone, to the University of New Mexico Law and Mental Health Didactic Series. This is a series hosted by the University of New Mexico Department of Psychiatry and Behavioral Sciences and the New Mexico Behavioral Health Services Division. We're so thankful for having all of you join us today. I'm Anthony Perillo, the Forensic Psychology Training Director in the Division of Forensic Behavioral Sciences here in the University of New Mexico's Department of Psychiatry and Behavioral Sciences. For our talk today, for our presenter, if you have any questions, enter them in the Q&A box, not the chat box, the Q&A box, anytime you feel comfortable. Just know that we do hold those until the end. We do try to get to as many as we can as possible, and just forgive us if we can't get to yours. If you are pursuing continuing medical education credits, there will be a sign-in sheet in the chat box shortly. For those of you that are pursuing APA continuing education credits, keep your eye on the chat box when the link comes up later on in the presentation. There will be a link to a survey that you will complete. Make sure that you open that link before you exit the talk and that you save your certificate after you complete the survey, because we don't keep access to those surveys after the fact. A recording and the PowerPoint slides for this talk will be available sometime later this week. And as a heads up for next week's talk in the series, we'll have Dr. Joshua Grubbs, who will be discussing the landscape of sports gambling and its implications on clinicians and for legal policy. But that's for next week. This week, I'd like to introduce you to our speaker that we've been waiting for. I'd like to introduce you to our speaker who will be discussing identifying and monitoring coercively controlling behavior in intimate partner relationships. This is Dr. Sandy Jung. Dr. Sandy Jung is a professor of psychology and associate dean of research at MacEwan University. She's an active researcher and educator who has numerous peer-reviewed publications on sexual and intimate partner violent offenders and is supported by internal and external grants. She's also a forensic psychologist who's testified as an expert on cases related to sexual offending and criminal responsibility. She has served and been monumental in various organizations, including ATSA, the Association for the Treatment of Sexual Abuse, criminal justice section of the Canadian Psychological Association, and serves on editorial boards for a number of different journals. Dr. Jung, Sandy, on behalf of the University of New Mexico, can I say how honored we are to have you joining our series and thankful for you sharing your expertise with us today. I will go ahead and turn it over to you.
Hey, thank you so much for having me, Anthony. I really appreciate that. After that very kind introduction from Dr. Perillo, I'm just gonna dive right into my presentation today. So thank you for inviting me to talk about coercive control, especially in intimate partner relationships. And so what I'm going to be covering today is identifying and monitoring coercively controlling behaviors in intimate partner relationships. And I have certain learning objectives, let me just click here, that I believe that you might have already in your slides. So before I do dive right into what coercive control is, the first thing I want to dive into is providing a bit of a land acknowledgement. So before I begin, I want to acknowledge that I'm presenting in Treaty 6 territory, which is the traditional gathering place for many Indigenous people. I like to honor the history, languages, ceremonies, and culture of the First Nations, Métis, and Inuit who call this territory home. So this is my very simple agenda today. What I'm going to focus on is why is coercive control problematic? What does coercive control look like? And then I'm going to spend a little bit of time at the end about how coercive control should be assessed and monitored, and some reasons for that, why it's important to actually give some thought to this. It's not quite as simple as assessing for partner violence in general. So I'm treating this a little bit like a slice of partner violence that is often ignored, often things that we don't sort of question. So I think it's important to really kind of delve a little bit more into what coercive control is. So most people are familiar with the all-encompassing descriptor of domestic violence. But the unfortunate thing is it's erroneously equated with physical abuse, things like assault, choking, strangulation, threats of death. But domestic violence also includes psychological abuse as well. And a subset of those psychologically abusive kinds of behaviors, which is, persistent attempts to control, frighten, or isolate intimate partners, is a subset that's known as coercive control. These are oppressive types of behaviors. Oftentimes they are considered non-violent. And really the goal here is that the abuser is trying to obtain control over their target. So in their case, their partner. And as we'll see, that this manifests in a whole number of different ways. If it was just one type of behavior you're looking for, it certainly makes it a lot easier to be able to question, to be able to observe. But as you'll see that in the next several slides, there is a significant problem with trying to determine what coercive control is and trying to actually address it as well. So before we delve into what coercive control even looks like, I think it's really necessary to point out what makes coercive control problematic in the first place. And there's many things that complicate identifying, intervening, and helping victims who endure coercive control. So we have to think about some of these things when we are even wrapping our head around any kind of partner abusive situation where you're assessing, for instance, the abuser who's been recently charged or convicted for this type of offense. So I'm going to start off with this. Even though longstanding abuse against a partner may be in plain sight of the criminal justice system, coercive control is much more difficult to actually see. We may not see these behaviors in records. We may not see them in charges or arrest documents. So really, it's officially invisible to us. Also, if you think about experiencing coercive control, the individual who experiences it, they're wrought with feelings of fear, impending doom, fears of what might happen next for them. So they're often intangible behaviors that they experience. In my own research, we found that rape myths are often perpetuated in the criminal justice system decision-making. Specifically, we looked at police decisions. So we looked at whether or not they were more likely to charge given certain circumstances in partner abusive situations. And we found that they're more likely to charge when it was involving non-sexual violence. It was more likely to lead to charge and arrest when it involved the victim sustaining injuries. In fact, it was like over 4 times more likely. There was a greater likelihood if there's no discrepancy and statements that the victims provided. And it was more likely when it was reported by someone other than the victim. So you can kind of see that these behaviors are not likely in coercively controlling kinds of situations where there's unlikely to be injuries. There's greater likelihood that these are going to be reported only by the victim because it's only the victim that experiences them. So it becomes really problematic when we think about the criminal justice system and the fact that it's going to be generally invisible or intangible. Let's think of the person who's at the heart of the coercive controlling behaviors. So the individual who perpetrates the violence. I recall in my own clinical work where I primarily had worked with individuals convicted of sexual crimes and less so with those who perpetrated partner violence. And when I did have those referrals, I remember, I'll be honest, at the time, I remember thinking that it was much more challenging to work with those individuals than with the individuals who committed sexual violence against children or adults. And this is for a variety of reasons. And one of them that really stood out for me was that they presented really well. It wasn't always clear what needed to be worked on. So this brings me to another problem with coercive control. He seems like such a good guy. And you've probably heard that before too, that they present generally well. If you ask other collaterals such as, coworkers, employers, what they're like, you'll often hear that a lot of positive types of things about the individual, because oftentimes there's this sort of like double life that they live, right? That they are carrying out these behaviors within the home with their partner, but outside of the home, they look like the greatest neighbor, the guy that's always willing to lend you a ladder. These are very different kind of personas oftentimes that the victim will kind of point out that people don't see what I see. When we think about intimate partner violence cases, somewhere about 40 to 50% of those partner violent cases involve behaviors that fall under coercive control. And what we know from those cases is that there's often low rates of reporting and charging. And many victims also point out that the worst might still happen, in those kind of situations if they were to leave the relationship or that they, decide that they're going to report the abusive behaviors to authorities. Oftentimes it might be in the form of threats of death, potential violence to their pets or their children, especially when their children are young and vulnerable in the infant ages or in elementary school age. Oftentimes the victim will point out that there's, mutterings from their abuser that's laced with ideas of murder-suicide, right? If you report this, I'm going to take you down with me, or if you go away, I'm gonna end things, and it's going to end things for you too. So these are the kinds of things oftentimes that would kind of wrap their head around, what's happening there. In fact, a lot of victims will often say that, it's easier to stay within that abusive relationship because they know what to expect. But if they leave that relationship, if they report this, the abuse, they're afraid of what might happen and how that might escalate later. And this is related to my next point here. What's remarkable is that we know for partner abuse that one of the best predictors of risk for future violent incidences is victims' perceptions of the perpetrator's likelihood to harm. We might miss it, but the victim sees it. And it's one of the few factors I would probably say that we see that the victim's perception actually plays a role in prediction. What we actually see in a partner violence situation is a slow buildup. So if you think about this graph of a single case, we see that the severity of violence, was very little at first. Police might use discretion because they might not charge for, a slap in the face, or, a push or a shove, things that they deem as negligible in terms of the level of violence. But as you can see in this particular case, that it didn't take very long for that violence to escalate, right? What's most remarkable about these kind of situations isn't the escalation. I think most of us are fairly aware that domestic violence oftentimes escalates over time, right? Increases in severity. But what's really remarkable about this is that throughout the whole time, if we think about the victim's perception of their risk of being harmed, it stayed pretty much the same all throughout. And like I said before, perception of the victim in terms of the risk that the perpetrator would have on harming them is actually one of the really good predictors. And we already know that history of violence, is a really good predictor, but perceptions of the victim is also a good predictor as well. Of course, we know that coercive control has a tremendous impact, on the victim. It reduces the victim's power to make decisions, places limitations on their independence. It diminishes their well-being and their self-image, their ability to make strong decisions about their safety. But we also know that that's a ripple effect as well. And the ripple effect affects the victim's children, right? Whether it's emotionally or, affecting their problems in school, causing behavioral problems. It'll affect their social supports, their relationships with their friends and their family, and affect their friends and families, emotional experience of what the victim's going through as well. But we also see that it might affect the victim's ability to be effective at work or their work performance. So it has this effect that kind of widens out to a number of different parties in that victim's life. Now, research has found that the likelihood of coercive control is higher among victims who are more vulnerable. And they often call this social entrapment because there's no way out, right, for these vulnerable victims. They're less listened to because English is limited for them. They're less likely to complain because they don't know their rights. They're less likely to seek help because no transportation or finances is available to them. Right? So they're not as independent for those reasons. There's a number of different examples you can imagine, right? So you can imagine that these kind of features in place and the social entrapment that might ensue would likely affect undocumented women, women of color, and women who have English as a second language. So much more challenging for what we call a much more vulnerable group. As I mentioned already, coercive control is often invisible to the criminal justice system. So, we're less likely to see charges and arrests that result from this kind of behavior. Now, in the UK, as of 2015, coercive control was deemed illegal. It was recognized by researchers that the focus of the existing criminal justice response on discrete, injurious assaults was too narrow to capture the pattern of coercion and control that exists. So they put that right in their criminal code. However, we think about other parts of the world, including North America, it is not illegal unless it fits under another criminal offense. So if it fits under other crimes such as criminal harassment or other crimes that you can imagine in your criminal code, then it might lead to charges. But again, most of the time, these are deemed invisible and intangible types of behaviors that makes it much more harder for charging and for arrest. So it's not easily captured. And again, much more difficult to lead to the justice system to become involved if we're only relying on the way we evaluate coercive control in the very general sense, unless it involves physical violence. Zoe Hilton published a recent study. It was a retrospective longitudinal follow-up, and what they found was that coercive control predicted the escalation of violence. In fact, they found two coercive control factors emerged in their work. One was called psychological control, which involved things like jealousy, psychological abuse, stalking, threats of suicide, and it also included controlling attitudes as well. So with these two factors, what they found was that they were both significantly associated with physical intimate partner violence after the index offense, and it also was associated with occurrence and severity of subsequent physical intimate partner violence. So it was useful in predicting future reoffending. So in light of these issues that are related to identifying coercive control for one, but also the problems that coercive control can lead to, whether it's reoffending, the impact it has on more vulnerable victims, and the fact that we're less likely to lead to charges because it's less tangible. We know that there's a lot of difficulties in trying to, do something about coercive control. So the reason why I think it's important to talk about what does coercive control look like is because it's really hard to do anything unless you actually know what it does. So we know what impact it has, but what we also want to know is what are we looking for, right? How do I identify what coercive control is when I'm seeing a partner violent person in my office, and I'm assessing them for their level of risk or for their treatment amenability, or we're trying to develop safety planning for the victim, right? It's important to identify what these elements of what makes up coercive control actually looks like. So to try to simplify things, and I want to simplify it because if we think about what or how coercive control is measured, there's at least 22 measures of coercive control that's available, and none of them are more used or employed than another, right? It's not as simple as, when you're trying to assess for psychopathy, most of us are very much aware that using the psychopathy checklist is often deemed the gold standard. There's a go-to oftentimes, right? There may be other measures, but there's clearly one that stands out above the rest. We don't see that with coercive control, right? There's a lot of different tools that are out there, but unfortunately not one is more likely used or deemed the gold standard than another. So I think there's still so much to learn about coercive control. So unpacking it means that it's important for us to simplify it enough for your purposes so that when you're doing any assessment that's related to a partner violence situation, that you're able to deconstruct and disentangle it. And so what I've done is deconstructed it to these four elements. So coercive control that's related to controlling finances, that's controlling the victim's relationships with others, that's controlling the victim's well-being, and also using power and threats as part of that coercively controlling sort of pattern of behavior. So I'm going to start with the first one. I'm going to start with finances. So one pattern of coercive control of a partner is controlling finances. This can look different across all partner violent men, but the overarching goal is to prevent their partner from gaining or maintaining their financial independence. We especially see this when we have victims who have limited independence. In fact, a recent study found that there's a greater likelihood of economic abuse when their relationship involves a victim who is of a lower income, so less than $30,000 a year. So we often see that there's a much more easier coercive control when in those kind of situations. Now, some ways that coercive control of the victim's finances might occur, might be presented in these different ways, right? It might manifest in these different kinds of ways. Preventing the partner from gaining or maintaining their financial independence by limiting their partner's access to money. whether it means controlling their bank accounts, making sure that they have their name on their accounts, making sure that their victims, pay or salary is going directly into their abuser's account, make sure that they have access to that, or just having their victims, their partners, hand over their checks for their pay directly to the abuser and signing it off on them to them. They might, if you don't have a victim who has a job or is not a breadwinner in the family, then what you might find is that the abuser will limit their allowance, right? Only limit their funds and keep track of their amount of money that they spend, so they can keep track also what they're doing with their time when they're not around. So there's different ways that they might limit their partner's access to money. Another way of controlling their finances is keeping their partner from going to work, right? Or even, a more excessive kind of approach would be to causing their partner to lose their job, right? And there might be a variety of ways that this might happen, causing their partner to be late to work, delaying them for a variety of reasons, whether they're berating them before they leave the house, having them miss days at work because of injury, could be due to physical assaults. It could also be, damaging things in the home that need to be fixed. Adding so much more to the victim's plate so that they have to leave work, or the fear of harming their child or their pet. So of course the victim feels compelled that they need to stay at home, and so they again miss more days at work. Having difficult time trying to keep up at work because they are either losing time or they are harassing them while they're at work. Preventing their partners from getting enough sleep, leading to a lack of sleep and tiredness when they go to work and affecting their work performance, potentially leading them to lose their job or lose shifts that they could have had. So a variety of ways that they can impact their partner's finances. Another way is to threaten to hurt their partner financially, or cause their partner legal trouble. Whole variety of different ways to affect the partner financially, whether it means, leading to their use of funds for a variety of reasons that the victim did not endorse. Could be also, affecting them, legally by, requiring the victim to have to get their own lawyer for separation purposes or child custody. Legal trouble can lead to these financial losses, but it can also lead to continuous problems that the abuser may want to inflict on their victim, such as calling the police on her, turning the tables around and reporting them to the police, having documentation of that, which leads the victim to then lose time at work, lose, opportunities to take jobs or take shifts. And then, of course, at the end of the day, causing them to become, again, financially dependent on the abuser. Now, there's another pattern of behavior that is probably a little bit more familiar to us, is when we think about coercive control, oftentimes we think about the abuser controlling the relationships between the victim and other people in their lives. So whether it means their family, their children, any of the supports that they have in their life. So there's a variety of ways that the abuser can do this, right, as you can see here. And so let me just quickly go through some of these to give you an idea of, again, how this might manifest in a relationship that involves coercive control. So some common ways that partner violent men might impact their partners is to isolate them from their families and their friends. Whether it means, preventing them from going to family events, making excuses that the car broke down so they can't get there, preventing them from going by filling their time with other things, right? So a whole number of different ways that they might isolate them from their support system. It could also just be simply, moving them farther away from their family and friends so they don't have the supports there to sort of build victims, independence. You can also see that, another way is to make jealous accusations to separate the victim from their support system. Imposing guilt, accusing them of spending too much time or more time with them than me. You value that relationship with your mother more than you value it with me. You value it more with your coworkers than you do with me. If it involves children, using the same tactic to turn children against the victim is another method as well. finding ways to say things to their partner to compel them to spend less time with their children, whether they're you know at a school age or whether they are adult children. Again, removing a support system that's there. Prohibiting them from using the car or isolating them from public transit is also another common approach. I mentioned before as well the idea of moving the victim to a different location so that it's harder to access public transportation, but also harder to access those relationships. You know, taking them further away so that the only way that they can contact others is maybe through texting or through phone, but not actually physically spending time with family members or others. So taking them to remote places, rural cities, a completely different city where they don't have the supports that exist for them. Keeping them from leaving the house in a variety of different ways, whether it means, you know, making a mess in the house so that the victim has to tidy up more often, damaging things that they have to fix, you know, having faulty, you know, appliances so that they have to bring someone in, whether it's for, you know, an electrician or other reasons, just to keep them at home. Sharing private information about their partner is another approach in order to turn people against the victim by sharing details with their family or their friends. So, you know, did she know that she hates you anyways? She's the one that ratted you out about losing your job. So just sharing those kinds of things directly with family members to coworkers, or even through social media and websites or Facebook, just to again do damage to the relationships that could potentially lead to the victim's independence. So those are two of the faucets. Now the third faucet refers to this other pattern that's quite common, which is perpetrators often engage in manipulating the victim's well-being. So there's, again, a variety of ways that this can happen. Some of you may have heard about before, again, falling under the spectrum of coercive control. So for instance, monitoring a partner's activities. This is one we probably hear about a lot when we hear about a partner abusive situation in the news. When we talk about monitoring all the communications that the victim has with others, whether it means, you know, very explicit kinds of things like checking and opening their mail or their emails, accessing their email accounts, reading their journals, personal papers, any of those kinds of things are quite you know, obvious. But some other ways as well, in addition to checking mails and emails, is by you know, keeping track of their phone calls or their phone use, right? You know, basically, you know, checking who they've been reaching out to, how long have you been on the phone? I've tried calling you numerous times. Another way of doing this, which is, you know, again, a form of harassment, is persistently calling their victims, right? You know, constantly texting them or calling them to check on them and their whereabouts. Other ways that they might do this, maybe more discreetly, is checking their wallet for receipts or smelling their clothes when they come home to check if they're, you know, they smell like smoke or they smell like, you know, a certain restaurant that they suspect that they went to with, you know, one of their coworkers, you know, or their ex-boyfriend. They just to check whether they've been truthful or not, and then making accusations that follow oftentimes afterwards. In some extreme cases, which isn't that uncommon these days, given the kind of tools that are available, is a client who stuck a GPS, a magnetized GPS, onto his partner's car. And, you know, if, it was found by the wife's family, actually, that he had bought a GPS, but the family didn't know exactly what he had bought it for. And the victim worked out of town. So, you know, I live in the province of Alberta. There's lots of oil fields. The victim worked out of town, would go out into the field, you know, be there for several days and then come back over the weekend. But he would keep track of her, and you know, she would, of course, you know, after a busy day at work, sometimes they would go grab a drink after work. He questioned her about it and said that, you know, where are you right now? And she said that, well, I'm heading back to the hotel. And he would text her and say that, you know, why are you at a pub? And she'd be like, well, how do you even know that I'm at a pub? Like, there's no way you'd know that unless you're physically here. And she figured out finally that he had tagged her somehow And so she had one of her coworkers actually check the car and found that there was a magnetized GPS attached to the inside frame of the vehicle, but she had no idea that he had put it there. So clearly he was keeping track of her, and it must have been for a few weeks because he had bought the GPS device, in the previous month. But these are the kinds of things that some people might go out of their way for in terms of controlling and manipulating the victim. More recently, of course, you've probably heard of Apple AirTags, which are wonderful little devices that you can kind of put in your bag in case someone steals it, or some people have attached it to luggage when they're traveling, just in case it gets lost, somewhere in the transfer from one plane to another. So one thing that had come up with these Apple AirTags was that there was some incidences. There was actually more than one incident where a domestic abuser had put an AirTag on the car of the victim. There's been other incidents I've heard where they've actually attached it in the victim's bag or knapsack, put it in the lining. They had no idea that it was there. Using these as ways to track their partner in these kind of partner abusive situations. I think that Apple's made some moves to making sure that if there's an Apple AirTag, that it would ping on your phone so that you'd be aware of it. So I think there's some movement towards that. I'm not sure how effective they are now, but you can imagine the more of these kind of devices in such a small little format, can be used in an abusive way in these kind of situations. Another way that partner violent men can manipulate their partners is by gaslighting. So psychological abuse where the abuser makes the victim question themselves about their sanity or their perception of reality, or even their memories for certain things. Oftentimes the victims feel very confused and anxious, unable to trust themselves. For instance, you imagine a victim who's upset that the abuser had spent her entire paycheck on alcohol and online poker. But then he turns it around and blames her for forgetting that he paid for the car parts. You're so stupid. You're so forgetful that these kind of things happen. And oftentimes when people are gaslighting, they will use the kind of approach of other people agree with me. You can ask any of your sisters, they'd say the same thing. You're so forgetful. You're so stupid when it comes to these kinds of things. They don't trust you. That's why they didn't ask you to look after their house, because they knew that you'd leave the door unlocked. Throwing sort of those things back at them to, again, make them question their own sanity or their abilities. And the ultimate goal at the end of the day, when abusers use gaslighting approaches, is to get the victim to second guess their every choice that they make, question their sanity, knocks down the victim's well-being and their self-esteem, and makes them more dependent on the abuser, because you need me to actually make sure that you get things right, that you don't burn down the house. Another tactic that they'll often use is to constantly reinforce, well, you're the woman, you're supposed to do these kinds of things. So reinforcing that traditional gender role often comes up, especially in relationships where there is a dependency, whether, I talked about the social entrapment. If you have victims who are, have English as a second language, who don't understand their rights since they moved to Canada. Another thing that we often see is manipulating the victim's well-being by controlling the sexual relations that they have and the type of sex that the perpetrator wants. Forcing unwanted sexual acts, forcing them to be okay, I'd say okay with video recording. But again, it forms another opportunity for the abuser to have something to hold against the victim in the future. Other more overt things is not letting their victim, take medication or limit their medication usage, and oftentimes questioning the victim's mental health. Even threatening them, or actually putting their partner in a mental hospital, or referring them to see someone. Making the kind of actions in place so that it leads the victim to feel concerned now that he's willing to actually take action on these things, that maybe this is real. The last facet is power and threats. So another strategy in using various ways to hold power and use control tactics and to try to manipulate the victim's independence is by engaging in these kinds of either direct or indirect kind of approaches. So again, there's a whole variety of ways that this could surface. And starting out with the first one, Preventing a partner from having the freedom or decide or make decisions is something that's also very common. Controlling the partner from looking after themselves, right? Controlling aspects of their health and their body by preventing them from getting enough sleep at night, keeping them awake so that they're always tired all the time, preventing them from exercising, which might boost their confidence and well-being and their self-confidence to actually leave the abuser. Controlling the victim's health by prohibiting them or limiting their medication usage as well. Threatening to take them to the hospital, I mentioned before, deciding for a victim about sex and not even using birth control. The more common thing that we often see or we hear about is the yelling and the put downs, right? Name calling, using nicknames for the victim to keep their self-esteem as low as possible. Again, some of these things kind of go hand in hand. By preventing their victim from not exercising and not looking after themselves, the victim starts having lower self-esteem as a result of that. And again, the put downs become much more impactful on them. Making threats is, again, a very common form of coercive control. It can be done in direct and indirect ways. Direct ways, obviously, are things like, threatening to hurt them or shoot them, causing death or significant harm, or that I'm going to do something, while you're sleeping, you would have no idea. They're in the most vulnerable kind of state. Indirect approaches are things like, having a mere look, right? Facial expressions that accompany a physical assault. So the victim often has this conditioned response when they get this look from their abuser that they know that something's going to happen. Or leaving sort of, I call it sort of the I was here cues, leaving stomped flowers on the walkway, or leaving gun shells on the table just to remind her that he's got a rifle stashed somewhere, that she has no idea where. Threatening indirectly again about having a victim deported, shaming them for using porn, even though it was the perpetrator that actually forced her to actually watch the pornography with them. Threatening the victim that's going to damage property that is very valuable to her, whether it's an emotional value, such as the remains of her mom, has been cremated, or certain kind of pieces that she had that, was kind of the last remnants she had of her father. These kinds of things that, again, could certainly threaten the victim, but they're more indirect kinds of threats that don't cause direct harm to the victim, but it's enough for the victim to either stay in the relationship or to follow through with what he wants her to do. There's also the potential of threats to others as well, right? To harm the children of their partner or their pets, have their partner reported, I mentioned before, or even harming himself so that, that she would have to live with that guilt that he entered his life because of her. Now, threats are one thing, but, making actual attempts is even more reinforcing, right? So actual attempts to harm or kill themselves, such as burning his skin or cutting himself, setting up a gun next to his bed, some physical thing that's actually physically there that she sees this cue each time. And it also shows that the perpetrator is clearly committed to actually carry out the threat. Another tactic is to physically hurt others, minor injuries to others, shoving her kid, grabbing their dog by the tail, just things that basically clearly he can do much more damage. He's willing to do those things. That means he's potentially going to harm, those in my life even worse. So these are ways to group these behaviors, which are often not violent, and therefore, again, not chargeable, right? And not likely to lead to arrest. But they provide a way for you to kind of think in terms of what should I question with regards to whether this person is actually engaging this behavior with the victim, right? That goes beyond solely looking at physical assaults and physical violence. Now that we're aware of what these things are, I think it's really critical to think about, well, how do we actually assess them, right? So great, you see what the warning signs are, you kind of see the ways that coercive control can be manifested in an abusive relationship. But how do you ask about them, right? You wouldn't ask them, you engage in coercive control. That wouldn't make any sense. Most people have no idea what coercive control means, for one. But the other thing as well is that who is willing to admit to that, right? Who is willing to acknowledge that they engage in threats and gaslighting and all kinds of behaviors to manipulate and control their victim. So trying to find ways to do that means trying to find creative ways, but also thinking in terms of how do I actually go about assessing and monitoring these things. So I'm going to talk very generally about, what questions to ask, how to obtain this information, and the kinds of things that you should be observing for. Now, there's no doubt that you're already doing some of these things already, but I think the one thing that usually doesn't run our mind when we're assessing partner violence situations is to go beyond sort of focusing on the assaultive kinds of behaviors and thinking about the pattern of coercive control that might exist in that relationship that is also damaging and impactful to the victim, but also the people around their life. So let's start off with the first one. So what questions do I ask? What do you spend time on? Asking them and probing activities. And again, you've probably done some of these with clients already and see that it's not too difficult to draw out more information if you give them a chance and not rush it. But asking fairly general questions and then prompting from that point onwards would be important. May I speak to your girlfriend? Very simple question, but finding out whether or not that your client actually allows you to do so. Would they allow you to actually talk to her alone, right? Is that okay, or does he want to be present when that happens? Taking the time to have the client elaborate on situations and incidences after you've asked them an open-ended question about something, and inquire about minor incidences, right? Don't dismiss things that might have happened. Oh, I was running late because there was some problems with the sink again, and she didn't do the thing that she should have done, because now we've got to call a plumber to fix it. Seems like a minor incident. It was related more because he was late for the appointment, but asking a little bit more about that incident would be probably useful to do, to get a feel for how they handle those kind of conflicts. What actually ensued about that? Does he blame her for it? What was her response to it? Has this happened before, and how does he usually deal with these kinds of things? How did they resolve it? Getting that kind of elaboration to get, again, a pattern of whether there is a coercively controlling kind of pattern that goes on in their relationship. Some general kinds of questions that I throw here. These are really mundane questions to get at each kind of facet. But just to give you some examples of what I mean when I say asking these mundane questions and then asking to elaborate on them, are important. So, asking, your client, how do you and your girlfriend spend time together? How do you spend your time when you're apart? For me, it gives me a bunch of different kind of ideas. Are they spending a lot of time together? Are they doing things that are mutually sort of gratifying for the victim and for the abuser? Do they even spend time apart? Are there times they spend time apart? Are they kind of healthy things that he encourages her to do? Or does he roll his eyes when she wants to do something that he's not part of? So just getting a feel, again, for the pattern that might exist in that relationship. Asking something like, what are some frustrations you have had in your relationship, and how do you respond? Again, being very good at wordsmithing, right? So not using terms like, what are the arguments you've had? Oh, we don't really argue, right? You can imagine the kind of immediate defensiveness that might happen there. Or clearly he knows where you're going with this, as opposed to, like, every relationship has frustration. So how do you handle those in your relationship, right? What do you do to kind of deal with it, right? Again, getting a very mundane question in there to try to capture, again, that pattern that might exist in the relationship. What does the spending look like in your household? Again, looking at that financial independence without asking who holds the money cards, who's got the names on the accounts, who makes the money, who's the breadwinner. Those kind of questions often lead to very defensive kind of responses, but just getting a general idea about the relationship. means that you can build some prompts afterwards to ask them elaborate further about, okay, so, like, so you guys don't budget, you said, okay, like other people. So how do you usually do that? Well, she's always overspending on stuff, but I keep telling her not to do that. And so you kind of ask, oh, well, just kind of wondering, like, give me an example of like, what did she overspend on? And then that you've actually, addressed with her. Again, just to get that feel so that you can kind of capture the different ways that coercively controlling behaviors might exist when it involves finances. Then getting into more detailed things like, you mentioned your wife keeps bugging you. What kind of things is she asking, right? So asking those kinds of things where, again, getting them to elaborate on it and describe, again, in a fairly mundane way. What I would always kind of remind people of when you're developing these questions ahead of time or practicing, especially when you're diving into the helping profession very early on, is to try to avoid yes/no questions as much as possible. So, for example, if you think of the first question on this slide, do you and your girlfriend hang out a lot? Again, yes/no question, not the greatest thing. Again, asking them how they spend time together means that they have to elaborate on it. I'd avoid as much as possible judgy kind of, evaluative types of questions. Why did you do that? Because oftentimes when we say that, we're almost expecting, okay, you're judging me on this. You're asking me my motivation for that, which means that you're going to judge why I decided to do that. And I don't like where this is going, right? So immediately you have someone who's got their back up. So avoiding those kind of questions by framing your questions in a way that you're just being curious, right? I just want to know a bit more about your relationship and sort of how it works. A second thing to think about is how to obtain this information. How do you gather this information? If you think about the different sources of information that you could possibly get, I always go with the safe side of going as varied as possible. Try and include collateral documentation. Any kind of documentation that's reported, not just in police reports, but also any documentation that if they've had, a psychological report on their son and, you'd like to get access to that if possible. It's a bit more about your parenting skills. That's what I'd kind of like to see. Getting that kind of documentation that comes from other parties would be important for us to get a wider picture. Getting information from current and past partners, right? Collateral persons in that abuser's life. What I always ask for is, what are collaterals that you can ask them for? And I always tend to go along the route of, who else is there that you would suggest? If they're suggesting their good buddy that they went to high school with, or their brother who completely backs them on the fact that they didn't do anything wrong. It really also tells me a bit more about the individual and how much they're maybe preventing you from trying to obtain information about themselves, genuine information about themselves. Then I'd ask them, in addition to that, is it possible to also get access to, you mentioned a friend that was there the time that this was reported to police. Is it possible to get access to Sue? Because, she might have some things to say. And again, seeing if you can access them, other family members, any mutual friends that they might have, coworkers that you might be able to access. And if they have adult children, is finding a bit about whether or not you can actually interview them as well. So widening the expanse of that report to, again, pick up the pattern of things that they might have seen in that relationship that either coincide or contradict some of the things that they're coming up. The last point about assessing and monitoring is, what are the things that you should be observing, right? So I tend to think that, assessing the openness, willingness to share or show texts that he mentioned that he had sent out to the victim. Can you show me that? I'm just kind of wondering, what that looks like, right? Because you've described it to me, but it'd probably be useful for me to actually see the actual text or take a look at the email that you're referring to, right? What's the thread look like? Not just the email that she sent back to you, but, like what is she writing in response to? Not requiring clients to show these things necessarily. So of course, these aren't required, but To me, the big thing is assessing their willingness can indicate their hesitancy or any concerns about their behavior that you might kind of tweak a little bit of that sixth sense, going, okay, there's something a little bit off, doesn't really want me to look at this, just wants me to take his word for it, right? Picking up on that defensive stance that might exist. If you get a funny feeling, you might not be wrong, right? Asking for elaboration. If they're unwilling to allow you to contact certain sources, asking them for confirmation about things that, well, you said you were, out with a buddy at a bar and stuff, and you're saying that this all happened and she went out for a long time, but you got back early. Do you have like your bill for that? I'm just kind of curious what time that was, right? Yeah, something you can refer to. And again, seeing how they respond to that. To me, the biggest thing that I keep in the back of my mind whenever I'm gathering information is being curious. I'm just wondering, right? There's no accusations here. Keeping, I always call it sort of game face on, so that they're not seeing sort of what's going on behind the intentions of me asking these questions, but really just kind of, I just want to gather information in order for me to get a really good idea about sort of what this relationship is like between you and the victim. So these are the kinds of things that, again, I keep in the back of my mind. Now, to identify challenges and obstacles, for the victim, it's important to keep that in the back of our mind, right? We know that there likely are going to be challenges and obstacles for the victim to have reported this, to have sought help, but that you may not know about. So keeping in mind those kinds of things, that the victim has those obstacles, reminds us that we need to do the best job we can to try to glean as much information as we can about the situation, or about the incident that was raised to begin with. It's really important to also address preconceptions that we might have. So avoiding preconceived ideas of what intimate partner violence looks like, avoiding immediately dismissing nonviolent behaviors, right? Not asking and elaborating about that, but just focusing only on the abuse itself, right? The physical abuse. It takes effort to challenge what immediately comes to mind, right? Opinions that we might have, judgment about the victim, perspectives about how the perpetrators, presenting really well about their situation. When we try to think about those preconceptions and raise those right to the forefront, with that new lens, it's more likely we're going to be able to identify coercive control. If we continue to have those preconceived notions and not recognize those obstacles that the victims are experiencing, then it's very likely for us to dismiss any kind of coercively controlling kind of patterns that are there. Being curious by asking relevant and pointed questions about their patterns, using clever ways to question them about it, again, using mundane questions, interpreting their behaviors by not downplaying the nonviolent behaviors. It really helps us to identify the multiple facets of coercive control, right? All of those kinds of ways it can manifest. So regularly asking relevant, pointed, open-ended questions by being curious is one certain way that we can actually get as much information as possible in order to actually have a better assessment. So here's the thing: we can thread out the mess that is, once we recognize and do something about each component. But only then, by unraveling this, by actually, removing our preconceptions, asking curious questions, thinking about the different facets that may or may not exist in this abusive relationship, only then we can actually eradicate this invisible and intangible part of partner abuse, and we can prevent further violence and violence from escalating. Because we know that coercive control is a risk factor, and it's something that actually is associated with escalation of violence in a relationship. So only then we can actually kind of disentangle this and try to prevent further escalation for that abuser to either escalate in that same relationship or in future relationships. I hope this has been helpful for everyone. I thank you for inviting me. So I'm going to ask Dr. Perillo if you can kind of rejoin again. But if you want to know a little bit more about any of my research, I do also have here a QR code for my website that you can be able to access, my contact information as well. and also include a few different references here, ones that I think are seminal to read when we're thinking about coercive control. And I think that Dr. Pearl probably wants me to show the QR code for the evaluation link, or should we show that in the end?
You can show that up for a little bit now here. Thank you so much, Dr. Jung Sandy, for a lot of rich information here, both factual, but also putting people in the room clinically so that they could picture not just what they need to know perhaps, but also how they could deliver and administrate some of this if they were actually in practice using this information. We do have several questions in the Q&A box already. I will merge some of these together and we'll do the best that we can to get through some. But of course, if you have questions in the meantime, you can continue to add those into the Q&A box. It seems like several people have asked questions that get at particular dynamics or different contexts of where the approach might differ, or if certain factors might impact your information gathering here. So I'll ask a few that are related to that. Several people asked something about when the coerciveness in a relationship is not clear or universally skewed toward one party and how that might impact the dynamic there. And so one person particularly said, many clients I see are in relationships where both partners are doing these behaviors to each other. When there's less of a clear victim-perpetrator dichotomy, how do you modify your approach in terms of assessment or treatment?
Right. Oops, let me just, sorry. Just point funny there. Here we go. Sorry about that. Yeah, so we do see that in a lot of partner violent situations, and it becomes even more difficult. You can imagine from the justice system's perspective, and who do you charge in a situation where you see mutual kinds of abuse? When it comes to that kind of situation, I will honestly say that I use a different approach just because it becomes much more complicated. What we often see in those kinds of volatile relationships where there is abuse going in both directions, and it's not always clear who the perpetrator is in those situations. What I often tend to kind of focus on is the issues within the relationship, right? The ability to maintain a healthy boundary, and it's very different when you're thinking about those kind of relationships. I'll be honest with you though, in a forensic setting, typically there is always identified perpetrator, whether it's actually truly a perpetrator or not, because there's someone who's been charged and arrested, and we tend to focus on their behaviors only. But when it comes to the kind of situation where you're dealing with a victim in a situation, for example, in a women's shelter, where you're seeing that kind of abuse and you're not necessarily dealing with the justice system as part of that, what I tend to focus on is the relationships that happen in their communication, in their ability to actually function as two independent parties, to try to draw attention to the impact that they have on the people around them. Because oftentimes there's other victims that are involved, right? So it's not just them victimizing one another, but them victimizing the children who might be involved, whether it's adult children or school-age children, whether it's their family and their neighbors and their support systems that don't know how to function in this volatile relationship that they have. So I tend to go in the direction, a less forensic approach and more focused on a communicative, building a healthier relationship. In a lot of those kind of cases though, keeping in mind that the solution isn't that you're going to resolve the relationship to better improve the communication. Sometimes separation is just maybe the only kind of option for that pairing. So when I think about couples counseling, I hate that term, but I'm talking about that relationship type of counseling. That's what I think is much more effective. It's identifying these kind of coercive approaches that they engage in with one another, and making sure you bring that to the forefront of any kind of intervention. But when it comes to the forensic side of things, unfortunately, it's just easier to think about just the abuser that you're working with, and thinking about how they can change that pattern, not necessarily going back to that same relationship, but in future relationships as well. So yeah, it's very difficult. I can't even imagine. I've read enough files in policing where you see that kind of the abuse that goes two-way, that you're not sure what to do with. And I think police don't know what to do with those kind of situations. So from a justice perspective, I don't think we've come to a resolution of how to handle them well enough yet. But I know that when you're talking about interventions, not choosing that forensic side of things where there's clearly someone that needs to instill change in their behaviors, but looking at the system together rather than looking at them separately. So I'm not sure if I fully answered that question, but I do choose a different approach.
You might have not just answered that question, but a couple of these follow-ups here, because I think some of these principles might apply, but I will go ahead and ask anyway. Some people also asked about how the dynamic is affected if the perpetrator is a woman, and how often that comes up in these scenarios.
Right. So as you probably heard me, I was using pronouns all throughout, and intentionally so, because I was focused on the fact that most of the research has focused on men. So so really for me to translate what I've presented here to women might pose a bit of a challenge, because we don't know enough about the abuse that is perpetrated by women. We know some, but we don't know a lot. You know, I'm currently, for example, looking at the validation of the ODARA Ontario Domestic Assault Risk Assessment for use with same-sex relationships and with women perpetrated. So we're trying to build a bit more of a normative sample so that we can actually have numbers that kind of go with the use of the tool. We're not there yet. So as much as I'd like to say that we have an approach for that, and whether it looks exactly the same, I say I'd use what I've mentioned here with caution when you're applying it to women, just because I can imagine the pattern will look differently. The few women clients I've had who've abused their partners, you know, I already see that they look quite differently, right? There's a different dynamic in that relationship. And there's certainly a very different kind of pattern of how it's executed or how it manifests. You're not going to see the checking of emails and text messages. You're not going to see that kind of pattern. You're going to see a very different kind of coercive control in the relationship that's very manipulative in a different way, right? So again, it looks differently. That being said, I wish I can comment more about that. There's just not enough research for me to kind of conclude.
Sure, and similarly, you referenced a lack of research or a minimal area of research in this area as it pertains to people in LGBTQ plus couples. And somebody had a question: are there clinically factors for clinicians to consider if they're in this scenario where they're working with LGBTQ plus abusers and victims?
Right. Again, I wish I can make more comments about that. There's still a growing you know, I think a growth of research that's happening right now. Whether we have conclusions from that, we just don't. I mean, even in Canada, which is where I'm situated, you know, there was a few different grants that came out from the federal government that was very much focused on the LGBTQ 2S plus, you know, population of abuse that happens within partners. And it's purely because it's in response to the fact that we don't know a lot about that. We do know that there is a different kind of oppressive behavior that I don't know if we've used that. We've used more of an intersectionalist approach to actually look at that with multiple pathways and multiple factors that we haven't considered when we're talking about a man being violent against a woman, right? So I don't think we have enough to be able to kind of make sort of generalized conclusions at this point. Sorry, I can't answer that.
Of course. A couple of people also asked about how you navigate these issues when there may be cultural contexts that come into play. Some examples being, how do you deal with this conflict, dealing with this within a legal therapeutic stance of our culture and respecting the cultural context of someone we might define as a victim, but whose culture supports or maybe even encourages certain patterns of behavior at issue, both physical and psychological?
Yeah, it's you know, it's interesting. I'll give you an example of something that I've been seeing much more of in our at least the areas that I'm most familiar with. So you know, I'm situated in Canada. I'm situated in Edmonton specifically. But one of the things that we've seen a lot of growth in is in the South Asian communities, where we have very much of a patriarchal kind of perspective, practices that happen, and very well adopted, I'd say, by those communities. The issues that I see in those kind of communities is there's been a bit more of a growth over the last, I'd say, couple of decades, where I'd say the normalization of reporting, normalization of what a healthy relationship looks like, has grown. And I think there's been much more awareness campaigns. What I see is representations across different parts of the justice system. So what I see in policing, for example, is there's a few initiatives, for example, in Edmonton. I saw some also when I was still in BC and British Columbia, where there was a growth of, I'd say, certain people in policing who championed reaching out to those communities and speaking to those communities. So police officers who would speak in their communities in a number of different mosques and different churches about that this is what a healthy relationship looks like, and this is what your rights are as a person who's experiencing victimization. And once you start seeing sort of authority figures, especially a male authority figure, which again, hard to erase completely, having a woman actually go there and actually speak on these issues and being trusted by, again, that patriarchal system, you start seeing changes in reporting. And that's something that we definitely saw here. There's not a lot written about that. I think there's growing programs that exist. They're more like white papers, but there's certainly not enough research that actually looks at those particular communities where you see very strong patriarchal perspectives. We know the reporting in some of these different cultures that have that patriarchal approach are much less, right? So, we always say that it's about 5% that's actually reported of sexual violence. You can imagine that when it comes to domestic violence, it's probably around the same or less, and even lower, smaller fraction of that when we're talking about different kinds of cultures that really kind of don't want to bring to the surface these kinds of abuses, right? Or see that this is actually abuse. So we're starting to see a growth of that. How I'd probably treat some of those programs, for instance, one program we used to run in the clinic I once worked at. So I was a clinician for several years before becoming an academic, was programs that we called it sort of a pre-program before they actually go into the domestic violence abuse program, where they would actually have someone who would champion this. So obviously a man, a woman facilitator, but it would focus on, in this case, for this particular program, a South Asian man who didn't want to be in that program, didn't think they did anything wrong, saw it as their right to be where they were. Some of them didn't feel as strongly as that, but they clearly carried that or were supported by their community believing that, would sit in these programs to talk about sort of what would be sort of normalized behaviors, and for them to express the challenge of them actually being in a normal, I'll say a normal domestic violence program with a bunch of other men in there who were raised in Canada. So trying to prepare them for that was something that we saw was really useful. So I think to address cultural considerations, I don't think we're going to be able to have something that's like one size catch all kind of thing. I think you have to look at the number of individuals at your service to try to figure out what we want to do with that would embody a group format, because what you want to do is you want to build a bit more of a reforming of a status quo, right? So that's some of the things I've seen that I think would be really helpful, but you do need to think about there's not going to be a program for an individual. It's really going to be look at what is the makeup of your clients.
Wonderful. Thank you so much, Sandy, for all of this helpful and useful information. We have so many additional questions from our audience. We are, of course, short on time here, but Dr. Jung has included her email address there. If you have any questions that you would like to throw her way, she's more than happy to have those sent to her. I thank you so much for presenting this information. I hope that a lot of our audience got a lot out of it clinically as well as information-wise. That wraps up this week's Law and Mental Health series. We hope to see you next week when Dr. Josh Grubbs will be talking about legal and clinical landscape of sports gambling in the US in particular. Until then, we hope you have a fantastic rest of the week and take care.
Thanks for having me.
Thank you.
Have a great week.
Yeah.